you want to talk about anatomical subbox, you have to actually magnify this area. Then you can see there are two tendons which are anterolateral boundary, and there's one tendon which is posterior medial boundary. So extensor pollicis longus is posterior medial boundary, yes, and these two are anterolateral boundary. Yes, let us discuss them now by looking at anatomical subbox. So this is anatomical subbox now, yes, and these are the two boundaries of anatomical subbox. Yes, remember, if you are talking about the posterior medially you have the long tendon, that is extensor pollicis longus, and anterolateral you have the short tendon, which is extensor. This is anterolateral, which is extensor pollicis. So one long tendon and one short tendon, yes, and then there is one additional boundary. Additional boundary is anterior, AA. So additional boundary is anterior, yes, AA. Abductor is anterior. So you're telling abductor pollicis longus is anterior, yes. Not the actual boundary, no, not the actual boundary, it is additional boundary, so AAA. You are telling that abductor is anterior and it is additional boundary. Yes, it is not the actual boundary. Then who is the actual boundary? If somebody asks you anterolateral boundary of the anatomical subbox, what will you answer? First, you should answer extensor pollicis brevis, and then the abductor pollicis longus. But both are anterolateral boundary or not? Yes, they are, of course. But preferentially, you have to answer. So extensor pollicis brevis is the actual boundary, yes, and abductor is additional boundary. Let us look at this again. The two tendons forming anterolateral boundary, and you are telling that the abductor is more anterior and it is actually forming the additional boundary. Yes, the actual boundary is extensor pollicis brevis. It is the anterolateral boundary of anatomical subbox. Then who is the posterior medial boundary? Posterior medial boundary is, of course, extensor pollicis longus. Okay, then what is the content? If you say content, then there is the radial artery as the content, and you can take a radial artery pulse by compressing the radial artery on the floor made by a bone and take the radial pulse. You will compress the radial artery content of the anatomical subbox at the floor of which bone? That is scaphoid bone. So I am compressing it on the scaphoid bone at the floor of the anatomical subbox to take a pulse. Yes. What if anatomical there's a scaphoid fracture? If there is a scaphoid fracture, then anatomical subbox is painful. Tenderness in the anatomical subbox is a feature of fracture of the scaphoid. And what is this at the roof of the anatomical subbox? Roof of anatomical subbox, you have the radial nerve, cutaneous branch, which is supplying 3.5 finger on the dorsum of the hand. So you have some radial nerve cutaneous branch which is going to the anatomical subbox roof and supplying 3.5 finger on the dorsum of the hand. Yes. And there is a cephalic vein also, which is at the roof of anatomical subbox coming from the dorsal venous arch. So there will be a dorsal venous arch which is giving cephalic vein, which is at the roof of anatomical subbox. Yes, there are two structures at the roof of the anatomical subbox. What is the answer to this question? Anatomical subbox, the content, we already know. You tell me. Radial artery? Yes. Now, if you say radial artery is there, fine. What about the radial nerve and cephalic vein? Radial nerve and cephalic vein, you already know, they were at the roof of the anatomical subbox. Now, if they're at the roof of the anatomical subbox, fine. What about the abductor pollicis longus? Abductor pollicis longus is additional and anterior, and it is additional and anterior contributor to the anatomical subbox. You mean to say anterolateral boundary? Yes, anterolateral boundary. Actually, it is not the actual anterolateral boundary. There was a brevis tendon. You mean to say extensor pollicis brevis? Yes, it is extensor pollicis brevis. This is just an additional component. So, what should I keep the actual boundary? Extensor pollicis brevis, because abductor pollicis longus is additional. It is anterior. Okay, you know, these two tendons are inflamed in decorative vein tenosynovitis. So one test will become positive. Which test? If you say these two tendons are inflamed, then that is dequervain tenosynovitis, the Finkelstein test. Yes, you have to do sudden ulnar deviation, and that is painful. Why sudden ulnar deviation is painful? Because these two tendons are inflamed. Anterolateral boundary inflamed. If you say anterolateral boundary inflamed of the anatomical snuff box, yes. So which two tendons you have? Which you tell me? It is extensor pollicis brevis and additionally abductor pollicis longus. These two tendons are inflamed. Dequervain tenosynovitis.